So I can't tell you how many times I've been working with patients and we're talking about their calf stiffness. And then my follow-up question to that is, do you have a history of back pain? Because some people don't understand that calf stiffness can actually be related to sciatica, old sciatica or new sciatica that they've had. They don't understand the connection, and that's completely fine, but there's a simple test that we can do to help figure it out. That's what the test that I use, and that's the test that I tell my patients to use to figure out, is this more nervy related to sciatica or is this true muscle stiffness? Because how you treat them is very, very different. But before we do that test, we're gonna go over a little bit of education of what does a calf tightness feel like, what does that actually feel like, and what is the sciatica type symptoms, what do those feel like? We're gonna go over a little bit of education, so we're gonna know more before we can do more. Let's get to the knowing before we get to the doing. Let's have some fun. So before we get to the doing and figuring out if it's calf pain or sciatica, I think there are some differences that you should know, because this may sound like you. And so calf strain or calf stiffness versus sciatica. And so if you're suspecting more calf, then I would suspect, if I'm evaluating you, that the area just generally feels achy and stiff, and that you want to move it. It feels like it needs to be stretched and you just haven't done it or don't know how to stretch it. And that's an area that maybe you've had an injury before, or that there's something going on, right, in the past that's just led it to be stiff and achy. Now, the big one that I typically see is that people have had a change in gait, and this happens usually over time, and that they don't realize it, but their speed and their length of their stride have decreased. That will result in calf stiffness. I treat so many patients in which I'm stretching their calves because of their gait deviation, because they're not striding out like they should, and they don't have that nice step length. And during that step, during that gait, we're noticing, or we actually know, that calf is stretched with every step we take. So think about, if you have 10,000 steps in a day, that calf is going to be stretched 10,000 times in a day. And so when you have that calf stiffness, that achiness, that gait change over time, which may be dramatic or it may be something subtle over time, you're having some calf stiffness. Now, what gets really interesting is that when I start questioning about sciatica type stuff. So sciatica, you may have had a feeling in the past of spiders or like a tingling sensation on your calf, maybe the outside of it, maybe in the back of it. Maybe you have a history of back pain, on and off back pain, or a back injury in the past. And these two are my favorite. So if you notice that your calf gets stiff when you sit and you're feeling like, okay, I feel like I need to stretch my calf because I've been sitting for a long period of time, and I can feel maybe one side feels a little bit tighter or a little bit more different feeling than another, then I've seen that be related to sciatica as well. And the big one here is that you've constantly stretched your calf. You're always trying to do calf stretches, but the calf is not feeling loose. And that's a big one for me, is that if you are constantly trying to stretch it, trying to move it, trying to get that good stretch, and it has no change, ooh, I can tell you that's going to be more related to nerve or sciatica type things. And we're going to go over that test in just a second. But those are some of the questions that I ask. And so you may find yourself checking the box on some of those and maybe, oh, maybe it's more sciatica, maybe it's more calf. We're going to go over the test in just a second to figure out the difference. But it is completely normal to have some of each. That you actually may have some muscle stiffness, but you also may have some leftover sciatica stuff. So we're going to go over that test right now and what you can do about it. Okay, let's go over the simple test to figure it out if it's sciatica or calf tightness. If you're just sitting in a chair, and so your legs are dangling and your knees are against the edge of it, if possible, you need to have some room down here. You're gonna sit up really tall, and if you just gently kick out and pull your toes back, if you feel your calf symptoms or tightness, it's most of the time related to calf stiffness. Okay, now because the sciatic nerve starts, well, the nerve, your spinal cord starts in the back of your head and it starts in your neck and goes all the way down to your lower back and splits out and goes down your leg. If we move our back or neck and we have an increase in symptoms, that's going to be related to nervy, more sciatica type nerve. And so we're going to kick out, pull back, and then rounded posture. If that increases any stiffness or feeling in the calf or the back of the leg, it's more nervy, more sciatica type related. And so when I work with my clients, most of the time they're going to notice some calf stiffness, which is absolutely fine. But they're also going to notice a dramatic increase when they go to kick out, pull back, and then round things out. They notice a gradual, a dramatic increase in their stiffness at that same time. So 9 times out of 10, it ends up being a little bit of both. They have a little bit of calf stiffness, and they also have quite a bit or a little bit of the neural dynamics or sciatica type symptoms. And so what I tell them to do is that you're noticing an increase when you round it out and a decrease when you get in really good posture. That's more nervy. If you're noticing just calf stiffness and no change when you move your back and neck, then that's more just calf stiffness. So the next question is, what do you do about it? Well, you use this technique as treatment. So if I'm working with somebody that has the sciatica type symptoms and a calf stiffness, and they could tell a dramatic difference side to side, and they could tell that they have some of that neural stickiness, or what's technically called adverse neural dynamics related to sciatica, then I will tell them that I'm gonna have you sit in that chair, I'm gonna have you kick up, pull back, and you're gonna do that 30 times. Kick up, pull back, kick up, pull back, and we're going to do that with really good posture. That's step number 1. 30 times really good posture, kick up, pull back. It has to be a lot. Remember, you walk up to 10,000 steps a day, and that calf is stretched up to 10,000 times a day. So you have to treat it with more reps. All right, so I'm just using an example on my right side here. So kick up, pull back 30 times. Now the level 2 part of that would be to have rounded posture. It's gonna look a little weird. Rounded posture, kick up, pull back. That's going to be an increase in pull, and that's going to be an increase in symptoms, but since you're not holding it, it's not going to be bothersome. You're going to kick up, pull back 30 times in a really poor posture position. I'll show you the other leg here. Kick up, pull back 30 times. Kick up, pull back 30 times. Okay, kick up, pull back 30 times. So you've got 30 times in really good posture, 30 times in really bad posture, and there hasn't been a single time that I've had a patient do that who hasn't reported relief in their stiffness, okay? Now remember, I'm not doing any of this for pain. I'm doing this for only stiffness, so this typically applies to people who've had chronic type symptoms for a long period of time, but it can be helpful for people in different scenarios as well. So now you know difference between sciatica type symptoms and calf type symptoms, and you know how to test it, and you know a simple way to improve how it feels. And if you get up and you feel better walking, I would like to know that. Please put that in the description, and I would just love to hear that, because I've seen it help many of my clients. So you've got 30 reps of good posture, 30 reps of bad posture, and then stand up and see how you feel. But as always, guys, please leave any questions or comments you have underneath the description. I will get to them. And as always, guys, stay healthy, keep moving, and take care of yourself.